here in studio. And I'm joined by Gloria Milimu. She's the health and science reporter on the actual state of doctors' strike in the country. Gloria, good to see you. Just to start off, what is the actual situation today, being the second day the strike has entered?
Well, indeed, like you put it, Fatia, we see that the doctors actually made good their threat yesterday, and a number of them downed their tools in various hospitals across the country. And today, like you've rightly put it, they've entered their second day. And what we're seeing from these hospitals, some of the primary healthcare services have been paralyzed. And like from what we filed yesterday, we saw a number of patients just complaining that we've gone to certain facilities to receive health services, but again, we didn't get what we had gone for. Maybe just to give a background of what is currently informing this current situation, this stalemate that we're seeing in the country, Fatia. Remember back in 2017, during the 100 days doctor strike, one of the issues that actually they were agitating for to be included in their collective bargaining agreement they entered into with the government to put an end to that strike that paralyzed health services across the country was payment of interns. And they reached a consensus that these interns would be paid at least a maximum entry salary of $206,000. So what the Ministry of Health is currently saying, Fatia, is that they cannot sustain this bill, this wage bill. They cannot sustain it because over the years, the number of medical interns that are being churned from all the medical colleges and institutions has increased. And when this happens, it also means that they have to increase their budget in order to sustain this huge number. As late as yesterday, I spoke to some of the sources at the Ministry of Health who said that they had received a total sum of 3.7 billion shillings to facilitate the launch of this universal health coverage, where we're expecting that Kenyans access equitable and also quality health care. So the talks have been going on. They kicked off yesterday for the better part of the evening. They were holed up in a meeting at the Labour offices, and also that is currently what is ongoing today. Both parties involving the national government, the county governments, and also officials from the Ministry of Health and also Labour to perhaps just reach a consensus in a bid to avert a crisis. Fatia.
Yeah, very comprehensive, very well said. Of course, you've also talked about some of the demands that they've had, including the medical cover. The government is actually yet to post around 1,200 medical interns. With everything that you've told us and where we are right now, how long are we expecting the strike to go for, and what's the way forward?
Well, like what we saw, allow me to take you back in 2017. Remember, the Labour and Relations Court issued an order just stopping the strike, but the doctors still went ahead, defied these orders, and went on to agitate, involving both tiers of the government, that is the national government and also the county government, considering that health is a devolved function, in an industrial action just to agitate for what they termed their rights. So basically, some of these issues that involve human resource, you cannot place a timeline for them. And also the talks, they can go either way. They might end up compromising on a number of issues or not even agreeing on a number of issues. And when this happens, Fatia, it's like we cannot tell that they will automatically reach a consensus. Like right now, my source from the Ministry of Health tells me that the Ministry of Health is actually questioning why they should continue paying doctors that huge amount, the 206,000, while other interns from other cadres of specialities earn at least 25,000 shillings. So they're saying that maybe they need to talk about this issue and agree on a level, on a standardized amount that these doctors should be paid. And also they say that there's some kind of allowances that these intern doctors are getting from these 206,000. Their argument is that these are not licensed medical practitioners, because even as they practice in the health facilities where they go to, they have to do so so under the inspection of a licensed doctor. But again, someone would ask, if you don't absorb these medical interns, you know, that becomes then a public health threat once they're employed, because what their job basically entails, it should be hands-on. They should be there to practice. If they don't do that, they become then a threat to the public in terms of administering the services that are required. So like right now, we cannot preempt whether they will reach a consensus or not, but for us it's just to wait and see what comes up from the meeting that is currently ongoing to help resolve the impasse.
Right, very well explained. Thank you so much, Gloria. That is Gloria Milimu. She's the health and science reporter, just giving us an update of the doctor strike that is